have to admit that when I wake up in the morning, I have to pinch myself to believe that they pay me to do the work that I do. And as an anthropologist working in the field of public health and working in the field of medicine, the methods that I use are the classic methods of anthropology, which are the qualitative participant observation fieldwork methods that anthropologists take for common sense, but that science and clinical practice actually is not familiar with. Although, in fact, clinicians every day practice, as far as I'm concerned, participant observation anthropology in their clinics, especially when they work like Brian on the front lines with incredibly vulnerable populations. So I think there's this potential for dialogue between anthropology and physicians that really hasn't been done in any kind of a consistent or major way. And what I find is that doctors respond well to it.
That's very important to me, is taking these interventions out into the community. So I don't want to just have whatever harm reduction work we do take place at Penn in some biomedical building. I want to be out there in the community, both for medical things, such as there's a free clinic we have United Community Clinic that's at First African Presbyterian Church out in West Philadelphia. That's the local church. That's where people are. That's where they're comfortable going. Similarly, Prevention Point Philadelphia. It's in Kensington. It was placed in Kensington for a reason, because that's where the drug problem is, that's where the people are, that's where they feel comfortable. And when we are out among the people, I think it does give a chance for us to kind of interact on more even terms.
Where the relationship is much, much more complicated is accessing the hospital, accessing the emergency room, accessing welfare offices or food stamps offices, accessing an employment agency, and so forth. The kinds of institutions that do reach people extraordinarily well are institutions that medicine actually doesn't interface that well with, or you should interface better.
I think what we try to do at Prevention Point is establish a relationship, establish trust. I think we have good cred out in the community, so we start from a good place, but we offer this panoply of services that keeps people coming back. We strengthen the relationship we have with them, and they further trust us. And that's really what gives us our success. People feel free to come to Prevention Point. They feel free to tell us what's going on in their lives. And I think that's so very important, because a lot of times we want to reduce the harm that's associated with intravenous drug use, but also we'd like to have people eventually have the ability to get clean and sober and turn their lives around. And you've got to give time for that to happen. We can't dictate to them, this is when you've got to change. It has to come from them. But keeping them around for a longer period of time makes that change more likely to happen.